I'm Dr. Anthony Kaveh, Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And I care for patients in some of the most stressful and fearful moments of their lives, either before surgery in the operating room or if they're in my clinic having a ketamine infusion session and undergoing psychedelic medicine treatments for severe anxiety, depression, PTSD, or other conditions. And all these patients have something in common, and their bodies, physically and mentally, are in severe pain. And they're often unaware of what's causing the anxiety and depression. And we're going to talk about not only the default mode network and how that interacts with our brains to enforce anxiety and depression. We're going to talk about psychedelics, anesthesia, sedation, and most importantly, what is a trance state? Not trans, but trance, trance, and how it's so important and valuable to us tapping into our inner healing potential. We're going to talk about amphetamines, SSRIs, SNRIs, and how they're all pharmaceutical ways that are very effective in the right context to helping address the underlying neurochemical imbalances of anxiety and depression, although they're not necessarily addressing the cause of anxiety and depression. So I'm really happy that you can all see me. I spent the last 10 minutes talking to myself, apparently, from the last live stream, much to my embarrassment until Heidi texted me. So good to see Sheila, Melika, Conky Dong, Robin. Excellent. I'm really happy you're all on to talk about this really powerful topic here about anxiety and depression, which is what you all wanted me to talk about in the last poll that I put out, overwhelming majority. So that's fantastic. Firstly, fear, uncertainty, and doubt. What do these three have in common, and why are they in my patients every day? And why do they torpedo not only our health, but also society's health? Well, let's just say it's not by accident that FOMO's first word is fear. FOMO, as you probably know, is fear of missing out. But the fear and FOMO, and quite frankly, so many other parts of society that's enforced by social media and print media and so many other parts of our daily lives, works to torpedo our personal health and society's health. And it's so clear when we are stressed out in the operating room, outside the operating room, really when our fight or flight response kicks in. When we're stressed out, our cognitive habit loops are revealed, and they often expose our fears, uncertainties, and doubts, which work in turn to enforce our fears, uncertainties, and doubts, and enforce the causes of anxiety and depression. Perseveration and rumination, as you all know, are underlying thoughts behind depression and anxiety. If it's rumination and perseveration of the past, we call that depression. If it's of the future, we call that anxiety. There's other causes and other thought patterns as well, but this covers the majority of the patients, certainly with situational anxiety and fears, like when I see them before a psychedelic medicine session or before surgery. And I'm looking at Teresa's comment. You're so correct, Teresa, about technology causing us to talk to ourselves. Very true. I'm happy that's not going on today because so many of y'all are already here despite me talking to myself for the last 10 minutes. So, pharmaceutical medications, mindfulness, spiritual awakenings, religious experiences, and psychedelic experiences all address the same phenomena in our brain. And that's where we're allocating our attention. In a very high form of focus, we can enter a trance state. When my patients are having surgery, especially if it's sedation, but even if it's general anesthesia, our brains disengage from the default mode network, which we'll talk about in a moment, to allow us to go into parts of our brain and consciousness that we're usually not attuned to. The point here is that our choice of where to put our attention is key because it can help us exit our normal rigid habit loops that our default mode network underlies. Default mode network is a combination of multiple cortical parts, meaning the outside layer of the brain. The one we talk about the most commonly is within the prefrontal cortex. When this default mode network is active in our default conscious state, we're thinking about the things that we think about every day in our normal waking consciousness. So if our habit loops involve perseveration and rumination of the past and future, if they involve engaging in fears, uncertainties, and doubts, of our daily lives, boom, our default mode network is very good at enforcing those habit loops day in, day out, for as long as we're awake and as long as we're not focused on something else. It's not an accident that when we put people in MRIs and MEGs or EEGs, even more accurately than MRIs, we see the default mode network begin to weaken when patients or subjects are engaging in goal-directed behaviors. Because goal-directed behavior means that you can't be daydreaming, you can't just be out in la-la land. You have to actually be focusing your attention on achieving a goal. And this is why focus is so powerful. And we have a choice. When my patients appreciate that they have a power to engage their focus and their attention in a goal-oriented behavior, the whole game changes, whether it's before surgery or if it's during the integration phase of a ketamine infusion, because it gives us a chance to step out of the perspective that we're limited to, the habit loops that we go in, day out, and instead can look at them from a different perspective. We can turn off the default mode network that runs our lives, unfortunately, when we're waking, walking, talking, for most of us, and we can actually focus our attention on something else like inner healing potential. So it's not by accident that amphetamines or stimulants that we use in ADHD, which, by the way, represents a similar form of default mode network, except instead of just daydreaming or repeated habit loops, it's distraction. Distraction is another form of hijacking our ability to focus and attend to goal-oriented tasks. It's not by accident that amphetamines are the basis of treatment for ADHD as well. It's also not an accident that ADHD prevalence has significantly increased for reasons that we can't explain. We suspect it's due to societal factors, at least in part. But amphetamines help us focus, laser focus. Ask anyone who's ever taken Ritalin or Adderall or Prestige. These medications all help us focus. They can also help in many cases with depression or anxiety because it can help us focus our attention. And as silly as this sounds, I'm not blaming any patients, of course not. But we have to recognize that where we choose to place our attention is worth a lot of money to Facebook, to Amazon, Instagram, TikTok, whatever. These business models are not secrets. We know that our eyeballs are worth a lot of money to companies, especially if we have money, like if we live in the US or other affluent countries. Those eyeballs are worth money and people are vying. They're literally tearing us apart, trying to get our attention. And who suffers? Us as individuals suffer because we become disentangled with ourselves, with our focus on our inner healing potential. The default mode network, when we're studying this in patients, it just shows the same thing repeatedly. Psychedelics disengage the default mode network. Meditation disengages the default mode network. Spiritual experiences disengage the default mode network. When we're focused on a goal-oriented activity, we're disengaging the default mode network. If we give ourselves drugs, we can do the same thing. When I give anesthesia to a patient, we do the same thing. So goal-oriented behavior, and that's what a trance is. Trance is simply entering a state of intense focus, whether it's clinically being hypnotized, not with a yo-yo, but maybe guided imagery, which, by the way, is as effective as low-dose oxycodone for post-surgical pain, not surprisingly, right? Whether it be through a psychedelic medicine experience being guided, whether it be through any of these other examples that I'm giving you, when we can focus our attention on something specific, that's where we can heal. It's where we can focus on biofeedback, focus on our heart rate variability, our heart rate, the vasodilation of the blood vessels throughout our whole body. I've done so many demos on my own body in the operating room. When I connect myself to life support monitors, where you see my blood pressure change, you see my pulsatility index change on the pulse oximeter. I've shown you so many examples on my own body, how with the right attention, we can change our physiology. No question about it at all. So our attention is worth gold. And that's why FOMO is almost encouraged by society. When we see Instagram posts in other places, that's the fear underlying, right, our default mode network, our fear, uncertainties, and doubts. FOMO, fear of missing out. From what? From external loci of control? This is why in a previous session we talked about internal versus external loci of control, and how when I have a patient before surgery, we need to help everyone engage their internal loci of control. Because that's where we can assume responsibility for our actions, including where we choose to place our attention, and disempower external loci of control. So I'm seeing so many great comments here. I'm just going to turn to look at them for a minute. Um, Robin, thank you for the kind comments. Teresa, my ADHD brain is definitely something sometimes, good and bad. That's right. ADHD, having focus be attended to, or having our focus go to different places can be therapeutic in the right circumstances, and engaging the fight or flight response can be helpful in the right dose, in the right context. Before surgery, if patients have a little bit of stress, they can actually have better wound healing because it recruits the inflammatory cells needed to wound heal, or needed to heal wounds, right? It's the right dose at the right time. The poison is in the dose, right? Not only for medications, but also for mindsets. So you're totally right. Teresa, I like it. Doggy, good to see you. Doggy says, do people sometimes shake during surgeries? Not if they've been giving muscle relaxants like rocuronium from the poison arrow dart frog, or succinylcholine. Good question. Teresa says, I've never been on ADHD meds. However, hyperfixation can make it seem like one with ADHD is on meds when not. Very interesting. Well said, Teresa. Lucy, good to see you. What would you do if someone was scared about a surgery the night before they're thinking of canceling? Lucy, this happens every week when I call my patients the night before surgery. And as you all know, I use this 3Cs model that I've developed to help with situational anxiety and situational fears before surgery. And just as a recap, those 3Cs, and I kind of have a fourth that I throw in there depending on the particular patient, is curiosity, control, certainty, and confidence. And when any one of these are strong enough in a patient, it makes it harder to fit anxiety and fear in the same brain space. If you have all four of them, it's even harder to include anxiety and fear in the same brain space. But that's where us eliminating fears, uncertainties, and doubts comes in to empower ourselves. Remember, you can't really have as much uncertainty if you're certain. Certainty is one of the C's. It's hard to be doubtful if you're confident in your decision. It's another one of the C's, right? These things are all almost mutually exclusive, never fully mutually exclusive, but hard to coexist in the same space at the same time. Robin, without my Addy, I'm so scatterbrained. Robin, you're not alone. There's many, many like you out there. But I hope that the Adderall does not eventually cause long-term side effects. We do know that all stimulants not only stimulate your brain to focus on something, but also stimulate the rest of your body through the adrenergic catecholamines throughout your body. They're hyping up your sympathetic nervous system, which is why we need to check your blood pressure, make sure you're not developing hypertension from high dose or persistent use of stimulants. Firemed Chick, aka, hey, let's talk about it. I've been on SNRIs for many years for my PTSD. If I forget to take them, my brain zaps. It's awful. Eventually, they started not working as well. Well, thank you for your vulnerability in sharing that. And you're getting to one of the points of the whack-a-mole approach to medicine, which is so harmful to so many of my patients. And I know you're a first responder. I'm sure you've seen this as well. When we silo the body and overly reduce our emotions and health and disease into just silos of this is the brain, this is the heart, this is the kidney, we lose sight of how they're all connected. And when we just see one disease, give it a name, treat it with a medication, that's whack-a-mole. You go symptom, diagnosis, treatment, boom, and rinse and repeat. You end up having so many medications, we call this polypharmacy. Every individual medication has its own set of side effects. So now you start doing whack-a-mole again with the side effects. Before you know it, you have this polypharmacy thing, especially in elderly patients. And we know that polypharmacy is associated, I suspect causally, but harder to prove, with more depression and more physical ailments. So, what you're describing in terms of tolerance and having brain zaps and having requiring escalating doses are one of the concerns for ongoing potent pharmaceutical medications. Of course, in the right context, they can be life saving, no question. But the goal in my clinic for my patients is to use the lowest effective dose for the shortest period of time. I'm not blaming anyone for taking medications. Absolutely not. I use them every day in the operating room for my patients, whether it be a psychedelic or not. But we need to look at the long term prospectus of what we're doing. Heidi, can you explain how Ritalin, et cetera, works with people with chronic fatigue that take it? How it works with the brain body compared to someone with ADHD? We are just like I mentioned earlier. It's a great question, by the way. Stimulants stimulate our sympathetic nervous system. When we enter the fight or flight response, like if we see a lion, we see a problem we don't know how to answer on a final exam, we're about to give a speech. Our body revs up the sympathetic nervous system, like you've seen on my own body when I connect myself to the monitors in the operating room. And what happens? Your pupils begin to dilate. You can see it yourself if you do this in a mirror. Your heart rate goes up, your heart rate variability goes down, your fingers get cold, your palms get sweaty, your blood pressure goes up because you're entering a moment of intense focus. You are releasing glucose from your breaking down glucagon to release glucose, so you have ample blood sugar. And this allows you to have more energy, at least for a brief period of time. So when you have chronic fatigue, certainly a short-term fix is to give stimulants just to rev the body up. However, like we talked about, there can be long-term consequences for doing that. Great question. Courtney Frazier, is this the first time I'm seeing you on here? That's great. What can we do if we were traumatized from a previous hospital visit to calm us down before an upcoming hospital visit? Great question, Courtney. Medical PTSD is so real. We talk about it all the time on this channel. It's why we do exposure therapy when I'm in the operating room doing a live stream, for example, or doing a video, because it turns out that exposure therapy, in the context of a trusting, safe environment, can help attenuate PTSD responses, especially if it's done in conjunction with controlled and compassionate reintroduction of the traumatizing experience. If I get the opportunity, I'll actually do a walkthrough of the OR again with the patient before the day of surgery, so they can have that exposure therapy in person with someone that they trust, who's compassionately guiding them through reliving the experience. In my clinic, I'll use IV propranolol to help mitigate and attenuate the sympathetic surge that comes on with reliving that traumatic experience. Great question. Hey, by the way, I don't do ad placement on here. I'm just sharing this information to help empower you all. And I would appreciate it if you hit that like button and share what you've learned with others, and hit the subscribe button to keep up with all my lives and all the information that I share. Your support helps me do this more often. And I would love for nothing more than not to have people come into the operating room again one day. It'll never happen realistically in this society, but if you don't have to come to the OR with me because you've empowered yourself, I'll find another job. I'm not too worried about myself. I just don't want to see unnecessary suffering in my patients in San Francisco and elsewhere in the world. All right. So many great comments here. Hey, let's talk about it. It says, my medication not working as well was a huge reason I started doing ketamine treatments, eventually hoping to get off of SNRIs. Fire med chick, you are not alone. That is such a common reason that patients come to me, either because medication doses are increasing, side effects are increasing as a result, or they're just not working well in the first place. And I certainly hope, and I hope everyone here sends you some positive vibes so you can wean off your SNRIs if safely possible under the direction of your prescribing doctor. Teresa says, I have ADHD and ME/CFS. CFS is chronic fatigue syndrome. ME, though, you'll have to break down for me, Teresa. Always wondered if stimulants would help or not. Well, Teresa, I hope you got your answer. Stimulants certainly can help for short term, for situational as opposed to generalized. The difference being that situational anxiety, you can treat with Xanax, for example, to go on an airplane. The risk of harm from once every other month using a Xanax versus daily Xanax for generalized anxiety, totally different sides of a spectrum. Just like using stimulants, for example, for long term versus for situational um, experiences or situational encounters. Very different. And unfortunately, in medicine, we're finding medications that are originally intended for short periods of time, whether they be proton pump inhibitors for acid reflux, whether they be albuterol for asthma, whether they be antidepressants like Zolofts or other SSRIs. They're being used for decades and decades and decades. And it's also not a coincidence that all of those common conditions, which comprise some of the most widely prescribed medications on the planet, have incredibly powerful mind body connections. Because there's nerves, obviously, in your brain underlying your anxiety and depression, but also all throughout your bronchial tree underlying asthma. And the vagus nerve is one of the strong contributors to the levels of gastric acid in the stomach, which can lead to ulcers or acid reflux. So, I hope you've all appreciated just how powerful the trance state is for my patients when either they're having surgery or even throughout life. Being mindful throughout life to not let our default mode network guide our lives is like not driving with a blindfold over your eyes. uh, Michaela Miller, good to see you. Looking forward for some uplifting vibes after spending a week in the psych ward. Oh my gosh, Michaela, I'm so sorry. I hope you're feeling better now. And uh, Michelle, good to see you back on the actual normally scheduled live. um, if we're going under non-anesthesia sedation and the anesthesiologist is willing to work with us, what meds, willing to work with us and what meds we get, our best options, what are the best options? What are the best options for brain and emotional healing? Michelle, that's a great question. Michelle's asking if you don't want anesthesia, but you're also willing to work with your anesthesiologist to maybe get a certain amount of sedation so you don't lose sense of control, but can still safely undergo the procedure. And correct me if I'm wrong, Michelle, I think that's what you're asking. It's going to, of course, depend on the surgery type, on your other medical conditions. So I can't give you specific advice like we've talked about before. But what would be an ideal scenario is to have a patient have low dose ketamine, possibly with low dose propofol. We actually call this ketofol in anesthesia. A combination of ketamine and propofol together can help you safely undergo procedures because you don't have as much respiratory impairment from the propofol because you're mixing it with ketamine. But you can also potentially, depending on how you dose the ketamine and propofol together, allow for a ketamine experience while having the procedure done. Uh, Very powerful combination. I use it myself pretty frequently, but it has to be done in the right circumstance. There's obviously considerations in terms of asthma, laryngospasm, etc., that ketamine can treat and can also cause. Um, Peace. Good to see you. What is trance? Well, we talked about it earlier, but I will repeat it again because it's so important. You got to break down these complex concepts into simple words, just like Albert Einstein said. He said something like, if you can't explain it to a 2-year-old, or a second grader, it means you don't understand the concept yourself. Being in a trance is nothing more than being in a hyper intense focused state. Intense focus, whether it's with a psychedelic inward or outwards, whether it be with a meditative state, a spiritual awakening, religious experience, anesthesia, guided imagery, clinical hypnosis. These are all intense focus based, as opposed to just, la, 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 ruminating and perseverating over habitual cognitive rigidities that underlie human suffering and disease. That's a trance. But unfortunately, there's many ways that society tries to pull us out of trance by trying to sell us garbage, by trying to help us feel like we're missing out on experiences so they can sell us more garbage. It's not controversial. It's just the business model that a lot of society runs off of. I'm not saying it's all bad, but in the wrong context for susceptible individuals who are already suffering, it can make a bad situation worse. Peace, I hope that answered your question. Jakey Bakey, good to see you. Does weight play a role in the absorption of anesthesia, of, say, propofol? Yes, it does. Catherine, is asthma a contraindication to your ketamine treatment? No, ketamine is actually something that I'll use for asthmatics in the operating room because ketamine is a bronchodilator. However, ketamine also increases secretions, can make you very juicy mouthed, and that can trigger laryngospasm. So I often pre-treat with glycopyrrolate, which is an anticholinergic that does not cross the blood-brain barrier, so it doesn't mess you upstairs, but it can help counteract ketamine's increased production of secretions. Catherine, good to see you as always, by the way. Lucy, how can you try and overcome a fear of anesthesia before surgery? Lucy, those 3 C's or the 4 C's, maybe I should just start saying 4 C's from now on. It sounds like the Four Seasons Hotel, so I've been always saying 3, but it's okay. Certainty, curiosity, confidence, and control are how my patients, the majority of them, when they can leverage 1, 2, if not all 4 of them, can literally crowd out fear and anxiety and doubt, which is typically the underlying source of patients canceling surgeries out of fear of anesthesia or the surgery itself. And that's why I called them the night before, so I can help leverage those innate healing properties of control, confidence, certainty, and curiosity, especially what happens to your brain right when you get in the anesthesia, leaning into our curiosity in that moment. I had a patient last week who was bawling over the phone with me when I called her. And it's not their fault, but it's very real. The struggle is real. And of course, I'm not blaming anyone. All right. Um, Teresa, thank you for reminding me what ME is, myalgic encephalomyelitis. Thank you. Annette states, good to see you. What if the doctors don't want you to get off of them? Annette, I don't think I've seen you on here before. Great to see you. If doctors don't want you to get off of SSRIs or SNRIs, the question is why. In some patients, it might not be appropriate to wean off of them because the risks and benefits don't push towards or don't support weaning off. It all depends on the individual situation. Great question. Sweet and salty, good to see you as well. Peace. Are kids in trance in early stages? I don't know what you mean, are kids in trance in early stages, but kids are far more easily hypnotized than adults because they have not had the same lifetime of cognitive rigidities that prevent them from entering magical states of thought, letting them focus on realities that are not shaped by the boundaries of the room that they're living in. So they can enjoy the benefits of clinical hypnosis more readily than the average adult, especially one who's been through intense cognitive rigidities and suffered from anxiety, depression, etc. Great question, Peace. Uh, Robin, it's so awesome to see that your therapist has helped you. And Teresa, we're going to end with you here. The illness of ME and CFS itself has not been taken seriously, and people think it's just being tired. Yeah, Teresa, you're right. And the reason why we think it's just being tired, it's not true, but why we've thought that is because we can't measure it. In medicine, if we can't measure something, it's very hard to get paid to treat it. It's very hard to get paid to study it. And that's what we're hoping to change. And certainly, psychedelic medicine has traditionally been hard to measure the effects of rigorously. That's changing as well. And that's why I try to use anesthesia whenever possible to help engage that healing, that inner healing that patients have, even though it's hard to measure sometimes. But just like how diseases are hard to measure. We thought multiple sclerosis was kind of in your head until we developed MRIs that could actually define the white matter lesions throughout the body. Same thing for conversion disorder, etc. Teresa, yeah, I'm going to, like I said, end with you here. If I've heard you can't be hypnotized unless you want to be. Is that true? No, it's not true, Teresa. It's not true. Many people that think they cannot be hypnotized can be hypnotized, even if they don't necessarily want to. Of course, if you don't want to show up, you can't be hypnotized. But if you don't want to take a pill, the pill won't work either. So wanting, eventually you can obviously prevent therapy from happening by just not showing up. But if someone's showing up, turns out the majority of patients can benefit from hypnotic trance state, even if they're skeptical or unwilling necessarily to believe it's going to work in the first place. Of course, Same with anesthesia. A lot of people think they're going to beat me in the anesthetic world, and I guarantee you that's never, ever happened. Please don't waste your time or effort trying. With that said, it's so good to see everyone. Oh, Chrissy Segan, first thing I think I'm seeing you on here as well. Um, I'm wishing you the best for your fibromyalgia. Same deal as CFS, as once what MS was as well in the past. When we can't measure things, we have a hard time treating them, and that's changing in medicine. So I hope that I can be an advocate for you, and I hope that more importantly, you can be an advocate for yourself because you have more power over your health than you've probably ever been told. I wish you all the best. Thank you again for your support by hitting the like button, sharing what you've learned with others, and following to keep up with all my lives. I really appreciate it. It helps me do this more often for you. Until next time, end stream button. There we go. It always takes me so long to find that button.